All you need to know about chest tubes. A chest tube, also known as a thoracic catheter, is a flexible plastic tube that is inserted through the chest wall and into the pleural space. It is used to remove air, pneumothorax, fluid, pleural effusion, blood, chyle, or pus, empyema, from the intrathoracic space. Chest tube care is an important part of patient care and management. Following are some care guidelines. Monitoring. Regularly monitor the chest tube and drainage system. Look for changes in the color, consistency, or amount of drainage. Also, monitor the patient's respiratory status. Securing the tube. Ensure the chest tube is securely taped or sutured to the patient's skin to prevent accidental dislodgement. Drainage system. The drainage system should be kept below the level of the chest to prevent backflow of fluid or air into the chest cavity. Also, ensure system integrity, no leaks, and that the water seal is maintained. Dressing changes. Change the dressing around the chest tube site as ordered by the healthcare provider, usually every 48-72 hours, or when the dressing becomes soiled. Pain management. Chest tubes can cause discomfort, so regular pain assessment and management are necessary. For the NCLEX exam, consider these important points. Patient teaching. Teach the patient not to pull on the tubing and to report any sudden increase in pain or difficulty breathing. Assess for complications. Monitor for signs of infection, such as redness, warmth, or purulent drainage at the insertion site. Watch for sudden increases in drainage or a change in the color of the drainage. No emergency procedures. Always keep a sterile water seal at the bedside in case of accidental disconnection. Accidental dislodgement of a chest tube is a serious situation that requires immediate intervention. Here is what to do. Emergency occlusive dressing. First, instruct the patient to exhale as much as possible and hold their breath if they can. Then, immediately apply a sterile dressing over the site. This dressing should be taped on 3 sides, creating a one-way valve effect that allows air to escape from the pleural space and prevents air from entering. Notify the healthcare provider. As soon as possible, notify the healthcare provider or a member of the rapid response team for further instructions. The chest tube may need to be reinserted. Monitor the patient. Monitor the patient's vital signs and respiratory status closely. Assess for signs of respiratory distress, including increased respiratory rate, decreased oxygen saturation, cyanosis, and altered level of consciousness. Prepare for reinsertion. If ordered, prepare for the procedure of chest tube insertion. This may involve gathering supplies, prepping the patient, and administering pain medication. Patient education. After the situation is stabilized, educate the patient about the importance of informing staff before moving, and about the need for careful movements to avoid dislodging the tube in the future. Remember, the NCLEX exam tests not only your knowledge but also your ability to prioritize. In this case, the priority is maintaining the patient's airway and breathing, so applying the occlusive dressing would likely be the first action. Thanks for watching.